Prescribing medications is a core responsibility of healthcare providers. It is essential to understand how medications behave in the body to make informed decisions. This is where pharmacokinetics comes in. Pharmacokinetics is the study of how the body interacts with drugs over time. It provides a framework for understanding drug absorption, distribution, metabolism, and excretion, or ADME. By understanding these processes, healthcare providers can optimize medication regimens for individual patients. This knowledge helps to maximize therapeutic benefits while minimizing potential side effects. In essence, a solid grasp of pharmacokinetics is paramount for safe and effective prescribing. The following sections will delve into the 4 key stages of pharmacokinetics. We will explore practical examples and highlight their clinical implications for prescribers. Mastering these concepts will undoubtedly elevate your prescribing practices, ultimately leading to better patient outcomes. Pharmacokinetics is a complex field, but its core principles can be broken down into understandable concepts. At its heart, pharmacokinetics is about what the body does to a drug. It helps us answer crucial questions. How fast does a drug enter the bloodstream? Where does it go in the body? How is it broken down? How is it eliminated? These questions are critical for prescribers because they directly impact a drug's effectiveness and safety. By understanding a drug's pharmacokinetic profile, healthcare providers can make informed decisions about dosage, frequency, and route of administration. This knowledge is crucial for tailoring treatment plans to individual patient needs. This ensures the best possible therapeutic outcomes while minimizing the risk of adverse effects. The first stage in a drug's journey is absorption. This is the process by which a drug enters the bloodstream from its site of administration. The route of administration plays a significant role in determining the rate and extent of absorption. For example, drugs administered intravenously bypass the absorption process altogether, entering the bloodstream directly. In contrast, drugs taken orally must first dissolve and pass through the gastrointestinal tract before reaching the bloodstream. The rate and extent of absorption can be influenced by several factors, including drug formulation, pH, and the presence of food or other medications in the stomach. Understanding these factors is crucial for optimizing drug therapy and achieving the desired therapeutic effect. The route of administration is a major determinant of absorption. However, other factors also come into play. The drug's formulation, for instance, can significantly impact its absorption rate. A drug formulated as a liquid solution will generally be absorbed faster than a tablet. This is because the tablet must first disintegrate and dissolve before the active ingredient can be absorbed. The presence of food in the stomach can also affect drug absorption. Some drugs are best taken on an empty stomach, while others are better absorbed when taken with food. For example, some antibiotics should be taken on an empty stomach to maximize their absorption. In contrast, taking certain painkillers with food can help reduce stomach irritation. Understanding these factors and providing clear instructions to patients is vital. This ensures proper medication adherence and optimal therapeutic outcomes. Section 5. Distribution, reaching the target, the drug's journey through the body. Once a drug enters the bloodstream, it begins to distribute throughout the body. Distribution refers to the drug's movement from the bloodstream into the various tissues and organs. The rate and extent of distribution depend on factors such as blood flow, tissue permeability, and the drug's ability to bind to plasma proteins. Organs with high blood flow, such as the heart, liver, and kidneys, tend to receive the drug more quickly. In contrast, tissues with lower blood flow, such as fat and bone, may receive the drug more slowly. The drug's ability to cross biological barriers, such as the blood-brain barrier, also plays a crucial role in its distribution and ability to reach its target site of action. Section 6. Factors affecting distribution, from blood flow to protein binding. Several factors influence drug distribution. Blood flow to different organs plays a significant role. Organs with a rich blood supply, like the liver and kidneys, receive a higher concentration of drugs. Conversely, areas with less blood flow, like fat tissue, receive drugs more slowly. Another crucial factor is protein binding. Once in the bloodstream, drugs often bind to proteins, primarily albumin. Only the unbound or free drug can exert its pharmacological effects. Drugs with a high affinity for plasma proteins will have a lower concentration of free drug available, potentially affecting their efficacy. Understanding these factors is essential for prescribers. It helps them anticipate potential drug interactions and adjust dosages accordingly. This ensures effective treatment while minimizing the risk of adverse effects. Section 7. Metabolism. Transformation in the liver, breaking down and modifying drugs. Once a drug has exerted its effects, the body begins to break it down and eliminate it. This process is called metabolism. The liver is the primary site for drug metabolism, although other organs such as the intestines and kidneys also play a role. The liver contains enzymes that chemically alter drugs, converting them into metabolites. These metabolites may be less active, inactive, or even more active than the parent drug. The main goal of metabolism is to make the drug more water-soluble, facilitating its elimination from the body. Understanding drug metabolism is crucial for prescribers. It helps them anticipate potential drug interactions and adjust dosages accordingly. This ensures effective treatment while minimizing the risk of adverse effects. Section 8. Excretion, the final farewell, eliminating drugs from the body. Excretion, the final stage of pharmacokinetics, involves removing drugs and their metabolites from the body. The kidneys are the primary organs responsible for excretion, filtering waste products from the blood and excreting them in the urine. Besides the kidneys, other routes of excretion include bile, feces, sweat, saliva, and breast milk. The rate of excretion depends on factors like the drug's chemical properties, its metabolites, and the patient's kidney function. Impaired kidney function can significantly impact drug excretion, leading to drug accumulation and an increased risk of adverse effects. Therefore, monitoring kidney function and adjusting drug dosages accordingly is crucial for patients with renal impairment. Section 9. Practical applications, using pharmacokinetics to tailor treatment. Understanding pharmacokinetics is not merely an academic exercise. It has direct, practical applications in everyday prescribing. For instance, knowing a drug's absorption rate helps determine the appropriate route of administration. A drug needed to act quickly, like pain relief medication, may be given intravenously for immediate effect. Understanding a drug's half-life, the time it takes for the drug concentration in the body to reduce by half, is crucial for establishing dosing frequency. Drugs with shorter half-lives require more frequent dosing to maintain therapeutic levels. Conversely, drugs with longer half-lives can be administered less frequently. Considering a patient's age, weight, and overall health is also essential. These factors can significantly influence drug distribution, metabolism, and excretion. For instance, elderly patients may have reduced kidney or liver function, necessitating dosage adjustments to prevent drug accumulation and adverse effects. Section 10. Case studies, real-world examples of pharmacokinetics in action. Let's consider a few real-world scenarios to illustrate the practical implications of pharmacokinetics. Imagine a patient with severe pneumonia requiring antibiotic treatment. In this case, an intravenous route of administration might be chosen initially to ensure rapid drug delivery and achieve therapeutic levels quickly. Next, consider an elderly patient with hypertension and impaired kidney function. Prescribing a blood pressure medication with a long half-life, like amlodipine, might be appropriate. This allows for once daily dosing and reduces the risk of drug accumulation due to impaired renal clearance. Finally, imagine a pediatric patient requiring pain management after surgery. Calculating the appropriate dosage based on the child's weight is crucial. Children metabolize and eliminate drugs differently than adults, making precise dosing essential to avoid toxicity. Section 11. Conclusion: Mastering pharmacokinetics for optimal patient care. Pharmacokinetics, often considered a complex subject, is fundamental to safe and effective prescribing. Understanding the 4 key stages: absorption, distribution, metabolism, and excretion allows healthcare providers to make informed decisions about medication choices, dosages, and administration routes. By considering a patient's individual characteristics and how they might influence a drug's journey through the body, prescribers can optimize treatment plans and minimize the risk of adverse effects. Mastering the principles of pharmacokinetics empowers healthcare professionals to provide the highest quality patient care. leading to better treatment outcomes and improved patient safety. Therefore, continuous learning and a commitment to staying updated on the pharmacokinetic profiles of commonly prescribed medications are essential for all prescribers.